and productive effort would not be possible. And I also want to share a couple of quick housekeeping comments. First, as you will have just seen, today's webinar will be recorded so that it can be accessed afterwards. And we'll send the link out in a follow-up email so you can feel free to share it with others in your network as well. And then second, in terms of Zoom norms, which we are all fairly familiar with by now, but please do feel free to be on camera or off, whichever is most comfortable for you. But do please keep yourself on mute, except when you are speaking. You can go ahead and raise your hand using the Zoom hand raise feature if you have questions or comments, and that's under the reactions button at the bottom of your screen there. There's a raise hand option. If you have trouble with that, you can also use the chat to chat in to say, I have a question, I'm raising my hand. And you can also use the chat throughout today's webinar to raise your questions and comments. And we'll be keeping an eye on the chat and trying to address what we see there as we go along. So the goal of this webinar series is to share more information and insight from a range of perspectives on the three main policy goals that the Essential Jobs, Essential Care Initiative is focusing on. So the first webinar in the series was held about a month ago on September 10th, and the topic was promoting economic stability for direct care workers. That's the first broad policy goal in this work, to advocate for livable, competitive wages for direct care workers and lift these workers out of poverty. Our excellent panelists were Jennifer Ashley from A Helping Hand, Patricia Calloway from Generations ASH, and Karen McLeod from Benchmarks. And if you missed that webinar but would like to check it out, you can still access the recording, and we'll be sure to drop the link into the chat for that recording. Oh, I think Heather's gone ahead and done that already. Today's webinar, as you know, focuses on exploring innovation to improve direct care jobs. And the final webinar in the series, which will be held on Friday, November 19th at this same time, noon to 1 p.m. Eastern time, will look at data-driven solutions to strengthen the direct care workforce. And we can provide a link to the registration for that webinar as well. Before I introduce our panelists for today and start this conversation, I want to share a few background comments, just real briefly. First of all, I want to make sure that we're clear about who we're talking about when we talk about direct care workers, because there is a proliferation of terminology in this field. So here, when we're talking about direct care workers, we're talking about the nearly 117,000 home care workers, direct support professionals, and nursing assistants working in various settings to support older adults and people with disabilities, from private homes to residential care settings to nursing homes and in other settings. And why are we talking about innovation in this workforce? Here's why. First of all, this workforce is already large and it's expanding rapidly due to the growing need for long-term services and supports. So in the next decade, from 2018 to 2028, North Carolina's direct care workforce will add nearly 21,000 new jobs. And to put that number in perspective, that's more new jobs than any other single occupation in our state, except for fast food workers. And maybe I should pause there. That's more new jobs than any other single occupation in our state, except for fast food workers. This is a growing job sector, and there's such growing need. And when we account for job separations as well, meaning when existing workers leave the occupation or leave the labor force altogether, we're going to need to fill about 186,000 total job openings in the same decade. But employers are already struggling across care settings to recruit and retain enough direct care workers to fill their current needs. And they've been struggling for decades, in fact. We've been talking about a workforce crisis for decades, but they're struggling now like never before. So what that means is that we need to think in new ways about how to improve direct care jobs and strengthen this workforce, to address longstanding challenges and to meet today's even more acute crisis. So we're talking today about innovation in a broad sense as new ways of overcoming old, familiar, deep-rooted challenges. So that might be new ideas, shiny new ideas, or it might be combining familiar strategies in new ways. Or it might be trying strategies that have been used elsewhere, like in different care settings or in other states. Or it might be about tackling recruitment and retention from new angles. thinking about supervision and support, or respect and recognition, or credentials and career advancement, along with the more familiar angles of wages and benefits and training. So there are many different ways to innovate, and that's what you're going to be hearing a little bit more about today. So with that, I'd like to briefly introduce our expert panelists, and then I'll give them each a few minutes to introduce themselves, their organizations, and their work in more detail. So we're really fortunate to be joined here today by Renee Batts, who's the project leader for NC Caregivers with Future Care of North Carolina, Ted Goins Jr., who's president and CEO of Lutheran Services Carolinas, Clare Luz, who is associate professor at MSU College of Osteopathic Medicine in the Department of Family and Community Medicine and founding director of IMPART Alliance, and Adrienne Smith, who is founder, president, and CEO of the New Mexico Caregivers Coalition. And to note, Clare and Adrienne are partnering with PHI to lead the Essential Jobs, Essential Care initiative in Michigan and New Mexico, respectively. So with that, I would like to turn it over to our panelists to take a few minutes each to introduce yourselves further. And Renee, I'd love to start with you. Please.
Good morning. Thank you so much for inviting me to be with you today. I'm very excited about our NC Caregivers program and feel very fortunate to be working with this program. Our goal in North Carolina is to recruit 4,000 additional caregivers in North Carolina nursing homes over the next 3 years. A survey that the North Carolina Healthcare Facilities Association did prior to COVID indicated that we had 3,800 plus caregiver deficit, that there was money funded, but there were not adequate applicants. This, as we know, COVID has only exacerbated the need for additional caregivers, and the staffing situation will get more pronounced as North Carolina's elderly population grows. And we feel, as far as NC Caregivers, that through our marketing and also through our working with the community colleges, proprietary schools, and with the skilled nursing facilities, that we can help meet some of these needs. So thank you for having me with you today.
Thank you so much for being here. Ted, would you please introduce yourself next?
Sure, and it's good to be with you all. Thanks for inviting me. Lutheran Services Carolinas has senior services and child and family services across North and South Carolina. All of our senior services are in North Carolina, and you know, this has really everything I do comes back to staffing, recruitment, and retention. You know, teammates are everything in all of the health and human services that we provide, whether that's group homes or nursing homes or assisted living. It's all about staff. You know, I started as a nursing assistant when I was in college, and learned very quickly that, you know, there's just nothing more important than having good quality, enough and quality staff in everything that we do. I thought I was getting a little easier task on the child and family services side, but it's all health and human services. So many direct care workers on both sides of the fence. And so it's just been really important to me and to us. And that's why I've tried to at least lend as much time and voice as I could to this effort. So thanks for letting me be here.
Thanks so much, Ted. Really glad you're with us today. Claire, would you like to go next?
Sure. So as Kezia said, I'm Clare Luz. I'm from Michigan at Michigan State University, and I'm also the director of IMPART Alliance, which was formally established in 2016. And our main goal is to help Michigan build an infrastructure to support this workforce, mainly through training, advocacy, professionalization, and culture change. And one cornerstone of IMPART Alliance is a comprehensive person-centered direct care worker training program that we developed in 2010 with some federal funding through a 6-state demonstration grant. And it's a 77-hour in-person training that we're now converting to virtual because of COVID through live 1-hour modules and Zoom. I'm also the director of a statewide direct care workforce advisory committee that was established from within our Michigan Department of Health and Human Services. It's a cross-sector committee with key state leader involvement. And we have 3 very active work groups, including one focused on professionalization. And finally, I do co-chair the Michigan equivalent of EJEC, which is a partnership between IMPART Alliance and PHI. And we have, one of our goals has been to establish a statewide coalition, a direct care worker coalition. We now have about 600 members. And the beauty of this coalition is the ability to mobilize people quickly for policy actions and to coordinate our messaging across all sectors and settings and programs. And I'm happy to tell you a little bit more about our work in a few minutes, but thank you for having me.
Great. Thanks so much, Claire. We do look forward to hearing more. Adrienne, please go ahead and introduce yourself.
Hi, everybody. Good morning, and thank you for having me today. I'm Adrienne Smith. I'm the president and CEO of the New Mexico Caregivers Coalition. Though I'm from New Mexico, though, I thought what was important that I share is a little bit about where I'm from. I'm actually something of a neighbor to you. Born and raised in Mississippi. Out of graduate school, I went to work for the Democratic Governor, Ray Mabus, on landlord-tenant legislation and affordable housing, and a little bit later on workforce development. And after that, spent some time in Washington, D.C. Around youth employment, National Youth Employment Coalition. I like to, and have over my lifetime made some noise, and I keep coming back to low-wage workers. I keep coming back to helping people come out of poverty. And when I moved to New Mexico, really started looking at this direct care workforce from the workforce development perspective, a youth employment, and said, you know, how can we do this better? There have got to be a lot of ways to do things better for people, to create better jobs for people who are doing the life-saving work of caring for people who are elderly and those with disabilities. So that's what we've been doing for 12 years here in New Mexico. I bring all of my experiences in my life, any knowledge that I have from where I came from with me every place I go, every day. And our mission statement is to advocate for caregivers in New Mexico. And part 2 of our mission statement is so that they may better serve people who are elderly and those with disabilities. So as I think about it now in retrospect of these 12 years, we couldn't have picked a more difficult thing to do, but we'll just keep doing it till we're not needed anymore. And hopefully, I hope we won't be needed one day.
Great. Thank you. Thank you, Adrienne, and thank all of you for being here today. This is rich, really wonderful diversity of perspectives, and all of you are making some noise in your own ways in this important work. So I'm glad that you're all here with us today. What we're going to do now is just dig in a little bit more into the innovative approaches that each of you are taking in your work. And I would like to start with you, Ted, if you're willing. I would say that the word champion is really apt for you, both in your work within your organization and beyond it. And I'm wondering if you would tell us more about how you and your colleagues have fostered innovation in recruitment and retention at Lutheran Services Carolinas.
Well, thanks, and that's very kind. I don't feel like a champion. In fact, I've got a picture right over here on my wall of the fellow that's tilting at the windmills, because sometimes it seems that way in what we're doing, and it's not the original, by the way. But I really feel like it's important that we stand up and make our voice heard. And sometimes it feels like we're making a little progress. That's why I'm thrilled to be a part of this, and with all of you and everybody that's on this call. Because as I was looking at some of the names, I see people that are as much or more a champion than I. You know, again, it all comes back to recruitment and retention for us. I'll start quickly with retention. You know, we just decided a few years ago, we were looking at a customer service program. We looked at Ritz-Carlton, we looked at Disney, and all those things are really nice, but they're not us. And we'd be pounding our round hole or our square peg into the round hole. And so we just decided to start with our own, trying to identify, we call it, we're not very innovative, we call it the LSC way. And it's to try to identify the people in our organization that do the job best, and then train the rest of us how to do it that way, how they do it. And it's just, you know, it's been homegrown and it's just been very successful. And I love hearing people say, that's the LSC way. And that's something that anybody can do. It also, we've now pushed it beyond just customer service to, you know, how can we use that to be better supervisors? Because as you all know, you know, supervision is one of the primary reasons that people leave jobs, that they just don't want to work with their supervisors, or their supervisors don't care. And so we want to be a better place to work and be better supervisors. And we're kind of wrapping that all up in our little homegrown system. So that's the retention side, which is very important. We got to keep those good people that have been with us for years, that want to continue to do that good work. And then on the recruitment side, you know, that's where trying to be a little innovative, but part of that has been advocating for a living wage, which brought a lot of us together, that we've got to pay a living wage. That means we also have to advocate for reimbursement. Since most of us are dependent on government funding, we've got to have the adequate reimbursement. You know, people tell me all the time, say, well, why don't you pay them $15 an hour? And I said, well, I could if I had the reimbursement, which is capped by the government. We also, and I see Jim Schmidlin is on this call, and he's the one that helped me break into the Puerto Rico. You know, we just knew there weren't enough people in North Carolina to fill our needs, and we reached out to Puerto Rico, which again does not have those foreign worker issues because they're part of the United States of America. Though some people have questioned me about that. And so far we've been able to bring over about 36 people from Puerto Rico to serve eventually as RNs, but they start as CNAs until they can get their RN. And we've brought 36 over so far. And I asked just this morning, okay, how many are still here? And I was a little disappointed that only 23, until I found out that, number one, that's probably a better attrition rate than our normal attrition rate. And those have been coming for over a year. And that's the other big thing that I never saw coming, is they come on a 1-year contract. Well, those contracts are now starting to end. And so they are starting to either go back home or move to where other family is in the United States. So they're starting to leave us now after they fulfilled that 1-year contract. So I just asked our folks this morning, I said, why don't we make that a 10-year contract? Well, you know, you just can't do that. But I wish I could. But they have been wonderful employees. And we've probably got an order in for 75 more Puerto Rican employees. But they can't provide them now. There are too many of us down there trying to recruit those workers, and they're just not enough to go around, especially with the additional. I understand the additional unemployment benefits kind of stopped that pipeline, but now that money has ended, we think that pipeline is going to open back up a little bit. But everybody is now down there, you know, recruiting. We also just put in an order for 50 foreign RNs from outside the United States using one of the visa programs. But again, you got to start somewhere. Those will take about 6 months. So 5 months from now to get those first workers in. But frankly, I need CNAs and dietary staff more than I need RNs right now. So it's all those direct care workers that we're dealing with. I advocate a good bit for a foreign guest worker program, not aimed at professionals, but aimed at direct care workers. But that's a federal issue, and I don't see that changing overnight. Certainly with the political climate that we've got, and then also quickly with our, we also do, my worlds are colliding. We do some refugee and immigration work. And all of a sudden we realize that we have the peanut butter of refugees and the chocolate of jobs, direct care worker jobs, entry-level jobs. And if we could put those things together, we've got something that's really helpful. And it's really bigger than us. So we're working with the North Carolina Healthcare Facilities Association and our national association, the American Healthcare Association, to try to match refugees and immigrants around the country up with direct care workers. And we're just starting to work on that, but I think there's some ability. It's not just one problem, it's a lot of problems. So it takes lots of little solutions. If there was one problem, one of you would already be rich and we'd be past that. And my last thing is just to support Renee Batts and the North Carolina Healthcare Facilities Association benchmarks and the other advocacy groups, including Heather and Kezia, to just try to advocate as loudly as we can for the change that we need, so that we can have enough people to do what we want to do, and that's to serve our clients. And I'll quit because I know we got lots more to do.
Well, thank you so much, Ted. So many important ideas and themes there too. Just a couple that I would draw out, this thinking about recruitment and how with growing need for long-term services and supports, we need absolutely more direct care workers to be entering the field. So we have to be thinking about new pipelines. We have to be thinking about identifying new populations of potential workers and drawing them in. And what does that take? What kind of adapted recruitment strategies and job features of the job and supports on the job do we need to match that as well? And thinking particularly about those who live or were born outside the United States, because we know that immigrants are such an important segment of the direct care workforce. Nationally, they're about a quarter of the workforce. And so we really need to think about how to build and strengthen that pipeline in particular. And then I also just want to highlight what you said at the beginning. I love that idea of really looking to your resources within your organization already. The workers that you have who are modeling best practices, who are really doing the work, are the best source of good content to inform your training and to sort of create a culture of recognition and collaboration within your organization that's more likely to both promote the skills that workers need to succeed in the organization, but also build that sense of sort of buy-in and commitment to the organization and a sense of being part of something that is more likely to encourage retention. So really great ideas there. Okay, well, you highlighted Renee's work, so I'm going to move to you, Renee, to invite you to tell us more about the NC Caregivers program and how it's structured and what it's, you said a little bit about it in your introduction, but how does it work and what is it hoping to achieve?
Okay, thank you. When it comes to the NC Caregivers, we modeled ourselves after the WISE Caregiver Career Program, which was the first effort in with Wisconsin. And with this effort, they had the Department of Human Resources that launched the program March 1 of 2018. And DHS received federal approval to invest $2.3 million to add 3,000 nurse aides in long-term care. When it comes to Future Care NC, we submitted a grant application that was led by Eric Cavisto and assisted by Melissa Parrish at Lutheran Services Carolina. So thank you very much, Ted, and myself, to the Centers for Medicare and Medicaid Services to establish the NC Caregivers program using civil penalty monies. They awarded us approximately $2.5 million to address the shortage of direct care workers in nursing homes. We were excited to receive the grant and appreciate the help of Governor Cooper, U.S. Senators Tillis and Byrd, the North Carolina Community College System, and leading long-term care advocates in our state for their letters of support. When it comes to NC Caregivers, we're looking at a two-prong approach, both in recruiting and in retention. So when it comes to the NC Caregivers, we're looking at marketing and advertising to attract interest in the profession. We're looking at the training that is being provided at local community colleges and proprietary schools across the state. And we are seeking to connect caregivers with participating facilities that have available jobs. So in saying that, we have a comprehensive media campaign. We launched our website, and please visit that, if not during this session, later at nccaregivers.org. We launched that website on August the 4th. When you go to our website, you will be able to see the 46 community colleges and the 7 proprietary schools that are participating. And when I say participating, they have signed on to assist us in this project. You will also be able to see the 226 skilled nursing facilities that have signed on. Now, when a skilled nursing facility signs on, what they are agreeing to is several things. One, that they will reimburse these student participants for their tuition and testing within their first month of employment at their facility. And if they stay with them for 6 months, whether they're working full-time or part-time, they will give them a $500 retention bonus. They are also saying that they will participate in our educational webinars. Over the next 3 years, we'll have 15 webinars for the facilities, and they are recorded. So if a person is not able to participate during the actual live presentation, they can go back later. So in this process, you're looking at all participants from all the skilled nursing facilities. All employees should have access to this. So we're very excited about that. And in looking at some of the topics, it'll be like do's and don'ts of employee appreciation during tough times, which was actually one of our presentations in April. Fearless in the face of crisis. We have introduced and sustaining organizational changes that's coming up this month, building on trust, that will be in the month of November. And then other topics such as how to use SMART goals for employee engagement, compassionate leadership and why that matters, inspiring with a shared vision, because we know it's one thing to recruit individuals, but we also have to retain them. Because if we don't, we have not made any really benchmark measure increase. So this is two-pronged, looking at recruiting and the retention aspect. In looking at the retention aspect also, one of the things that the facilities are saying that they'll do is participate in our annual surveys, which is an employee engagement satisfaction survey. And we had our first survey during the month of July, that it was sent out to the participating facilities, and the employees were supposed to return it by August, and the skilled nursing facility administrators received their results in September. We will be weaving in the results into our topics, educational webinars over the next 3 years, so that we can look at improving what our current culture is and making changes. Next year in July, we'll be doing another employee engagement satisfaction survey to see how we have improved over the past year based on the interventions and innovations that have been included at the skilled nursing facilities. In looking at marketing, if you go to our website, as I said, you'll see 4 videos that have been created. They're animated videos. In the future, we will also be having videos that's added onto the website that are live shots that were done at several of the skilled nursing facilities in Burlington and Raleigh area in the month of July. And we're very excited about those because that will include live interviews with actual CNAs, talking about their aspects of their job, why they're there, why do they stay, and what it means to them. So I believe that will be an excellent recruitment tool for people who are considering the CNA as a profession. So those are some of the activities that are currently going on. We're still in the early stages of the program. We actually signed all our contracts and it went into effect March 1 of this year. And we're looking at a 3-year project. So our end date is February 28, 2024. So in saying that, currently, when it comes to our benchmarks, we have 226 nursing homes, as I said a few minutes ago, that have signed on to participate. We're still recruiting. So if you're attending this webinar and you have not signed on, please do so. We'd love to have you. We have 46 community colleges and 7 proprietary schools, so we are still recruiting our educational partners as well. As of October 7th, we have 109 North Carolina caregiver participants. And what that means is someone has gone onto our website and they have initiated the beginning process where they have indicated that they would like to be a nurse aide. Some of them are already enrolled in community colleges and proprietary schools. Others have not started that process, but we're very excited about 109, and we hope to see those numbers increase. You may have seen us recently on TV or radio. I hope you have, or if you haven't, I hope you do in the near future. October 1 through November 15th, we've started a media campaign where we will have 30-second ads on TV as well as on radio, and that will go through November 15th. So that's a little bit about where we are at this point. As I said, we're in the early stages, but we are looking at both recruitment and retention of nurse aides in long-term care. As I said earlier, our overall goal is 4,000 over the next 3 years.
Wow, Renee, thank you so much for that, for talking us through the program. I think it's such an exciting initiative, and absolutely is innovative, but also comprehensive, and speaks to that point that Ted made about the need for multiple solutions, that we need to sort of tackle this challenge from various angles and perspectives. And you've built in the recruitment piece and the retention piece. And I love, in particular, the capacity building element of it, the webinars for providers to help them build their skills and ability to really center and support their workers as well, to keep them in their roles and help them succeed. Really, really interesting program. And I think we'll be watching carefully to see how it unfolds as more folks sign up and be able to chart your success with it. Thank you. Okay, well, I'm going to move on, and I encourage folks to use the chat feature if you have questions about this or reactions to what you're hearing so far. But in the meantime, I will turn next to Claire. So you personally, and as the leader of IMPART Alliance, have been studying and advocating for direct care workers in Michigan for a good amount of time, for a long time, with a particular focus, it seems to me, on training, credentialing, and professionalization. So can you tell us a little bit more about your efforts and sort of what drives that focus and your achievements so far? And you're actually on mute. Thank you.
Yes, I'd be happy to. It's a challenge, and as same as Ted, I also have Don Quixote on my wall. And like Ted and Renee, we believe this is it's a problem that is created by multiple factors. We've always taken the approach that these factors are all interrelated, and we have to address all of them simultaneously in a very strategic, coordinated, statewide way. And it's important to raise wages, but that alone won't fix the problem, especially when wages are restrained by Medicaid reimbursement rates, as Ted said, and the competition in the private sector right now is so intense. And training is needed. I'm a big advocate of training. That's the cornerstone of IMPART Alliance, but we don't want just warm bodies, right? We need people who know what they are doing and who care. Like the Carolinas, we have a drastic shortage. It's estimated right now that Michigan needs approximately 32,000 more direct care workers than we already have. So we need to get the numbers up, but we want these people to be qualified. I don't think we want to be paying someone $17, $18 an hour who doesn't know what they're doing and who could actually bring harm to their clients. But training or credentials alone are not going to fix the problem, because you could have, the best trained worker in the world, and it doesn't much matter if they are only getting paid $12 an hour and can't make the rent and don't have transportation to get to the job or gas to put in the car. And I also believe we won't get anywhere until society places a higher value on this workforce. And one way to address all of these issues, in my view, is to professionalize this workforce, meaning to establish the hallmarks of any profession, which are quality standards, comprehensive training that maps to those standards, credentials, career pathways, and this should lead to higher pay and greater respect. I mean, that's the way it's supposed to work, right? I did mention that we have a statewide direct care worker advisory committee in Michigan out of Michigan Department of Health and Human Services. And I think that this state leadership recognizes that an integrated model that crosses all sectors is really critical. For the first time, we have people from behavioral health, aging services, Medicaid, regulatory folks, providers from all the different settings, long-term direct care workers themselves, all talking with each other. It's a novel idea. We're all talking with each other and seemingly pulling in the same direction, which is sort of historic. And it's allowing us to take some steps forward towards professionalization. We've developed competency standards that were endorsed by the entire committee. And those have been submitted to the director of MDHHS for review. And we're waiting to hear what the next steps are for those. We're hoping those will be made statewide competency guidelines for all direct care workers. We're developing a model training program that maps to those specific competencies. IMPART Alliance is adapting its training programs to align with whatever is happening at the state level, so we can hit the ground running if these come down the pipeline. We're considering a new classification of direct care workers with 3 stackable levels within it, each with an associated training guidelines and associated credentials. With those that receive the most training would be referred to as a universal direct care worker that can work with any population of clients in any program, any setting, any payer. And one thing that COVID has taught us is that we need these workers to be portable and we need a more efficient system. So we're hoping that will address some of those needs. We already know, as somebody already mentioned, that the workers often are working in multiple settings anyway because they can't make ends meet with one job. So they might be working in a nursing home and also in home health care. We're also pursuing what we're calling fast track strategies that I'm happy to give you a lot more information about if time permits. But for those of you who maybe are providers on the call, I do hear some pushback from providers about training requirements, training standards, because understandably, they do not want unfunded mandates. They don't want to be told this is required. And by the way, you have to pay for it. So we're looking at ways to increase the number of workers without sacrificing the quality and without putting undue burden on the providers. And one way is to come up with a system where people can waive out of training. We have a lot of wonderful workers who already have credentials or competencies. And if they could demonstrate those competencies, maybe they could just get this additional credential without having to go through lots and lots of hours of expensive training. So those are some of the things we're working on, and I'm happy to tell you more if time permits.
Thank you so much, Claire. What I'm hearing from you is at the meta level is the value of us talking to advocates across state borders, because I think there's a lot that you're really working on in Michigan that North Carolina could learn from in terms of really trying to reach for this gold standard of stackable, portable, competency-based credentials for direct care workers that make individual direct care workers have more career mobility and options and make the whole workforce much more flexible and sort of deployable as needed across settings, but also thinking about what are the implications for providers and making sure that there are fast track options that recognize experience and skills just really an awesome model that I'm really glad that you shared with us, and we can take with us in thinking about what's possible in North Carolina as well.
Thank you.
I know that we would, sorry, we would love to.
I'm learning from you as well. So.
Oh, great. That's the ticket. I'm going to move along to Adrienne now. And then I know there's one question in the chat that we'll come back to. And we'll also have a little bit of time for a few more questions, although we're racing through because there's so much good content here. But Adrienne, I would like to call you out as a champion as well. Everyone on this call is a champion, but you are a real champion for direct care workers in New Mexico in particular. So can you tell us more about New Mexico Caregivers Coalition, your efforts and achievements over time?
Yes, I'll try. Ted and Claire talked about tilting toward windmills, and I have a Winston Churchill laminated saying right on my calendar, and it says, "Success is going from failure to failure with no loss of enthusiasm." And my husband just thinks that's the worst thing I should have up. He thinks that's so sad. And I said, well, you can always just go back, like you go back on Monday. When you're fried on Friday, just pick up and go back again. So I think a lot of us on this call probably share a lot of things in common about our values. And that's probably where we start. And that's probably why and how a lot of your organizations were formed. I know that's how New Mexico Caregivers Coalition was formed. So what we did back in 2008 was we held town halls are big here. I don't know if they're big in North Carolina, but we it's a big part of the culture. We go from New Mexico is the 5th largest state in the country, geographically speaking. So we just go from town to town and we put out flyers back in 2008 and said, any caregiver who wants to come and talk to us about the challenges, the issues you're facing, and bring us your solutions too. And we'd go to a community center, we'd give them a microphone. All kinds of people came out. In fact, that was how we found our first board members for our organization, and they happened to be all caregivers. Those listening sessions formed the foundation of our programs. And those listening sessions, and this is both happy and sad, we've stuck with what we said what they told us back then. We validated it twice since, in 2012 and 2014. But the things they told us in 2008 really haven't changed very much. They said wages and benefits, we need better professional development and training. We want advocacy for ourselves. And every time we talk about that, they actually brought up their clients. They defaulted to talking about their clients more than they were themselves. And so we had to bring them back to, no, we're talking about you. What do you need in terms of legislation? And then lastly, they talked about social, I guess you'd put that in the area of professional development. But I think what they talked about really was networking, being able to, in a small town, it's really hard to go have lunch with somebody from a different company than yours, and then have, without other people talking, oh, are you thinking of leaving this company to go to another one? So I understood that right away. Those listening sessions then told us we needed to worry about wages and benefits. We needed to worry about better training. We needed to worry about advocacy, and we needed to worry about professional development and social networking. And I think, as probably everybody said so far, and like I was on a webinar just 2 days ago, those national folks said the same thing. These problems are so big, they're so ingrained, they've been with us for 200 years, in a sense, if you know your history about this work, and they need a lot of solutions all at once. And when you go at them, like we've done, and like my Churchill comment says, you're just going to mess up, you're going to make people angry. And then you've got to come back and try it again and try a different method or try a different communication style. And so I'd like to say that the coalition kind of has, grown into something that's representative of a lot of stakeholders. But when push comes to shove, the first people that we're standing up is caregivers. you know, if I put them in, and I've never thought about this until you asked your question. And then in that order, you know, it'd be care recipients. And we just try as hard as we can to bring providers with us, for us, along with us. And it's only this year that we've actually, you know, found an area, and that's on data collection. You know, we all need better data collection. But there has been historically, with regard to our organization, a lot of miscommunication. We're a right to work state. So there's been a lot of, no, you know, don't worry about that Caregivers Coalition. They're just trying to unionize. And we wouldn't know the first thing about how to do that in the first place. So we just, you know, the thing is, you just, instead of kind of the, what might the word be, the, you know, the pushback, it'd be, we would be better off to just say, that's not what we do. Let me tell you what we do. So just, and so constantly your message, constantly, you know, what can we do better? What can we do more of that's better? What can we do more of that's better, that brings more stakeholders together? And all of us on this call have been talking about this workforce crisis for so many years. We're in it now. And so it really does need all of us to really change it. And I feel like we're on the cusp of it. We must be on the cusp of it. I got to retire at some point, and all these other people have got to go on after us. A few years ago, I wrote a magazine article, a newspaper article on robotic care. It's on robots, you know, caring for people who are elderly. And it was because I had just read about that taking off in Japan because of the demographics. And in China, as a matter of fact, parents may sue their children for lack of care. Well, in Japan, the demographics are also inverted. There's way too many older people for the few people that are left to care for them. And I said, there's no way that would work in this country. We wouldn't have it. We wouldn't stand for it. And yet, you know, I wonder if we hadn't fixed it by now, and if these workforce issues like the low wages can't be fixed, you know, I wonder if that's the solution. I'm not suggesting that it is, just that it just seems sometimes we've tried so many things. But I think it's like Ted Goins said, you know, if it were just one thing, we would have fixed this long ago. Thank you.
Thank you. Thank you, Adrienne. What I would love to pull out from all of it that you just shared is the innovation of going directly to direct care workers and saying, what's going on with you, and what are you experiencing, and what do you think would help? What changes do we need to see? And starting from that point and returning to that point over and over again to make sure that we are really, you know, focusing on what is most important and most needed right now. And the other two themes that I would just pull out from across all of your presentations that are so clear to me are that, first of all, innovation is not about one. You know, we tend to think about innovation as like the newest thing or the shiniest thing, but I think innovation in our field is thinking about how we can address these challenges more comprehensively. So how we can bring different strategies together to address all of those different pieces of the problem at the same time to the extent that we can. And the other innovative piece that I think we're seeing more of now than we have before, and that's come out today, is to attack this, or sort of tackle this across sectors, across stakeholders, across settings of care, because this is just so much bigger than an individual employer or part of the long-term services and support sector or population or anything else. It's a really common problem, universal problem that we need to. What's innovative is actually coming together and all pulling in the same direction, as Claire said. I have one specific question in the chat, which was for Ted, about whether, this is from PHI's own Peggy Powell, and she was wondering whether in your strategy of recruiting from Puerto Rico, have you also reached out to local Latino agencies as another recruitment strategy within North Carolina?
Two things along those lines. You know, when, and again, it was just so perfect that we have our Refugee and Immigration Services work, and anybody can have access to not just us, but to a lot of those services all over the state. But we actually asked our Refugee and Immigration Services how do we welcome these people to Wilmington, North Carolina, or Winston-Salem, North Carolina? Because if you bring people in from anywhere, even if it was just across the state, and put them in a community where they don't have any resources and they don't have any friends, what are the chances that they're going to be successful? And I think that's one of the reasons why we've been so successful at retaining them, because we actually used our internal resources in our case to say, what do we need to do? How do we need to culturally and just physically welcome them, and we did that in a number of different ways, including mentors from the facility that were already there to mentor these new people, and kind of welcome them into the fold. That worked out pretty well. We have had a little bit. We've not done near enough of the other as far as reaching out to the groups that are already here. We did have a program in one of our facilities years ago that back the last time we went through this, probably about just a little over 20 years ago, when we had a huge labor shortage, and in some of our communities we're down to like 1.2% unemployment. And we reached out and actually ran a CNA training class in Spanish for Latino CNA. So we did a CNA class and an English as a second language class all at the same time. It was wildly popular. We brought 14 CNAs that worked for us for over 5 years. But a lot of them turned out to be, and again, that was in a different era, a lot of them turned out to be undocumented. And eventually, as those were found out, they ended up having to quit. And they were some of the best workers we had. We had a big group cry over that, because we actually won a statewide award for the program, and then ended up losing a lot of them because they were undocumented. And here we have, wonderful workers that want to work, but those are some of the pitfalls that we're going to all have to deal with, through this whole process. But we need to do more of that, and haven't done enough.
Well, thank you, Ted. Thank you for that reply. We have just a few moments left. And what I would like to do to wrap up, really, because I promised this question to my panelists, is give each of you just 30 seconds to a minute, maybe, to say, if I were to be able to take out my giant checkbook right now and write you a blank check, how would you spend it? Where would you put the money within your own organizations or within our broader system to really innovatively address some of these challenges that we're facing? And anyone who would like to jump in, just go ahead.
I'll jump in. For IMPART Alliance, I would love to have enough money to hire staff. I have one staff member, that's it. And create an endowment that's big enough to sustain us for a long time to come. And for the workforce, I would raise wages to at least $20 an hour and have annual cost of living increases and benefits and all of the benefits that go along with that, and provide free training to anybody who wanted it.
Great. Thank you, Claire.
I would say, if we're talking about the minimum wage, we're always going to be chasing a number that's way out of date, probably. So I love how Claire talked about a $20. The first time I remember saying, why are we talking about minimum wage anyway? Why don't we start at 22? That was a few years ago, and people just looked horrified. But it's nice because it turns the conversation around. I think a livable wage with cost of living increases, provider reimbursement rates that are adequate. And then I loved, I just saw Dick Chady's in the chat, and I'll just tell you something that recently down the street from us, Bernalillo, New Mexico, minimum wage here is $9 an hour. And that's only because it's just come up since 2019. McDonald's is posting an $11 an hour entry level, 4 years of college paid, discounts on moving and rental cars, And it's all I can do. I'm sitting on my hands, trying not to write to caregivers to say, go apply there. Because if that's what it's going to take, I mean, and that's too, I'm just telling this group because I figure if I say this more, then I won't do it, because I'm trying to chide myself from doing something that feels like the responsible thing to do would be send people to Amazon, send people to McDonald's and Walmart, because something about this field is not working fast enough for people to stay alive.
Thanks, Adrienne. Renee?
I was going to say, if we had a blank check, I kind of would like twofold. One is to have monies to do scholarships for nurse aid training and their testing up front to eliminate the upfront costs rather than the reimbursing after the fact. And then the second check I would use to provide more money to the NC Caregivers Initiative so that we could increase the marketing and advertising of the venture, provide more educational webinars than the 15 that we have planned, and expand it beyond 3 years.
Great. I'm uncapping my pen right now. I'm going to write that line check. Thank you, Ted.
And I agree. I mean, living wage, and I was going to say 18 because I was not going to be greedy, but it really does need to be 20. I would support that today, but just a living wage to reflect the real work that people do, and also that foreign guest worker program, because I don't care what we do, there aren't enough bodies in this country to fill all the jobs that we have. You know, it's gotten politically correct to say that if we just get people off of welfare, you know, that or whatever, and that's not the answer. The answer is there aren't enough bodies to fill Renee's slots in her class. So we need to open up more people, and that's got to come from somewhere else. Years ago, I heard a professor say, you people, to a board that I was one of the youngest ones there, that said, you either need to start making babies today or you need to open your borders. That's your only two choices. And right now we're not doing either one.
Great. Well, thank you so much. We are right at time, or just about a minute over, actually. So I will wrap us up again with just huge appreciation. Ted, Claire, Adrienne, and Renee for joining us today and offering your approaches and strategies and successes as well. I think we have so much to learn from each other in how to innovate. And we have lots to do all together. So thank you all to all of our participants as well for joining us today. I have dropped the link into the chat for the next webinar, which will be on November, let me just make sure it's November 19th, I believe. And we're going to have a great panel and a great discussion then as well. But again, thank you all so much. Enjoy the rest of your day and the long weekend.
Thank you.
Bye.
Bye-bye.
Bye, everyone. Thank you.
Thank you.